This video is prepared to illustrate ultrasound-guided intralesional methylene blue injection for the arthroscopic decompression of spinoglenoid notch cysts. The authors declare no conflict of interest. The atrophy of the infraspinatus muscle is clearly visible under appropriate lighting. Coronal and sagittal T2 weighted images demonstrate cystic collection located at the spinoglenoid notch. Additional axial T2 weighted images reveal the exact location of the cyst in close proximity to the posterior glenoid rim. The patient is prepped under sterile conditions in the lateral decubitus position. The cyst is visualized with a linear array ultrasound transducer and an 18-gauge spinal needle is introduced in plane. When the needle tip is clearly visualized in the cyst, it is infiltrated with 2 to 3 milliliters of methylene blue. A slight expansion of the cyst confirms the accuracy. The patient is prepared in the lateral decubitus position with the arm secured in lateral traction. The posterior portal is established and navigated to the anterior portal that is subsequently used to visualize the establishment of posterior and posterior superior cannulas. A diagnostic arthroscopy is performed to identify and address concomitant pathologies. A liberator is introduced through the posterior portal and the torn or frayed labrum is elevated gently to visualize the spinoglenoid cyst laying beneath. Using a 5.0 mm shaver through the posterior superior portal, careful debridement of the torn posterior labrum and the soft tissues posterior to the scapular neck is performed while preserving adequate soft tissue for posterior labral reconstruction. Following adequate debridement, the cyst can be distinguished as a bulging structure with bluish reflection. At this point, care must be taken not to advance the shaver or any instruments beyond 1 cm medial to the posterior glenoid rim. After the identification of the cyst, its wall is destructed using the shaver and the methylene blue egress is documented with its dark blue steam-like appearance. The cyst is then explored with the guidance of the blue dye, and the tainted tissues are debrided as much as possible in order to avoid recurrence. Preoperative ultrasound-guided methylene blue injections help in identifying the cyst as well as in the elimination of all cyst-related tissue. Thank you.